What is osteoarthritis? Osteoarthritis, or arthritis, is an illness that affects the joints. It is the most common type of joint illness. It results from the slow loss and degeneration of the joint cartilage. The joint cartilage serves as a cushion to protect the joint bones from rubbing against each other. This wear and tear loss of the cartilage will slowly damage the joint, and this will cause pain and make it hard to move the joint. What causes osteoarthritis? We do not know exactly what causes osteoarthritis, but a lot of factors can lead to it. It is more common in females and older people. Extra weight, family history of osteoarthritis, and past injuries are possible causes for the illness. Overuse of the joint from certain types of work, like farming, construction, or heavy lifting, and sports like baseball, football, and soccer can also lead to osteoarthritis. What are the symptoms of osteoarthritis? Pain is the most common symptom and is usually worse with activity. The joint might also feel stiff and hard to move in the morning, but this stiffness lasts for less than an hour. Mild swelling can happen, and sometimes you can feel a nodule of bone around the joint. In severe cases, it can become hard to move the joint. Osteoarthritis can happen in any joint, but the knees, hips, joints of the hands, and spine are the most common areas. How is osteoarthritis diagnosed? Diagnosis in many cases can be made by the doctor in the office based on the symptoms and by examining the joint. An X-ray image for the joint, if needed, can also help make the diagnosis. There is no blood test for osteoarthritis, but sometimes blood tests are needed to look for other forms of arthritis like rheumatoid arthritis or gout. It is important to know that osteoarthritis is different than the other types of arthritis as it has no inflammation in the joint. Other arthritis illnesses cause joint inflammation and are treated differently. What is the therapy for osteoarthritis? Because there is no cure for osteoarthritis, therapy is focused on reducing the symptoms and slowing the worsening of the disease. Two factors in treatment are important. First is preserving the joint movement so we do not lose our ability to use it. And second is reducing the joint pain. Therapy will be different from person to person, depending on which joints are affected, how bad it is, and what other illnesses the person has. Therapy starts by trying to lower the stress on the joint. Lowering the stress on the joint can help lower the pain and make the joint move in a better way. We can do that by weight loss, taking brief periods of rest, and doing exercises that increase the muscle's strength. Your doctor can refer you to a physical and occupational therapist who can also help. Some people will need a medicine to help with their joint pain. Medicines that can be used to help with joint pain include acetaminophen or Tylenol, non-steroidal anti-inflammatory drugs, also known as NSAIDs, like ibuprofen, naproxen, or aspirin. Some pain medicines come in cream or gel form that can be placed over the joint. This is like Voltaren gel or capsaicin cream. If these do not help, then injecting the joint with certain medicines like steroids can result in less pain for a few weeks or even months. Joint injections with hyaluronate, a substance that is made inside healthy joints, may help with knee pain from osteoarthritis, but it does not work with other joints. Surgery can also be used, but it should be done only after other therapies are tried. Replacing the joint with an artificial one is done to help with pain and joint movement. This can be done for hip, knee, or shoulder joints.